because what happens when that nerve gets inflamed, it causes the entire lower body to go in spasm, especially when it's on L4 and L5 on the main sciatic branch. Then the inflammation just spreads through the nerve to all the muscles of the body, causing them to contract. That contraction then is what impedes the body from healing, because it puts more pressure on the low back and the spine, and it never gets a chance to get rest and recover. Even when the person is sleeping, the muscles are busy working and contracting, and the person slowly gets worse and burns out. So it's very important that people recognize that when they're working on this, is that it's not just the L4 and 5 injury that we are looking after. We are looking after the entire body and all the side effects that happen along with that injury. Okay, now in the beginning we had to be very careful when we moved Liz, because she couldn't roll over to the side and hardly could get up and sit up. Now that's not a problem anymore, but I will demonstrate anyway the proper way to move a client when they have injury to the low back. So first thing we will do is we will raise their knees. So then I will have my bolsters ready. And what I will have Liz do is first I will have her breathe in, deep breath, and then breathe out, and I will have her contract all the muscles of her abdomen, making it really firm around the low back. And now when you're ready, we will move her all at once, shoulder and hip, over on the side. You ready, Liz? Okay. And she'll tighten her stomach and roll over at one time. There. Then very carefully, I will have her move over. This way, there is no twisting and turning, which when there's a herniated disc is very dangerous action to do. That's when the nerves can be impinged and damaged. So now this is our position in which we will then work on the glutes, the tensor, the quadratus lumborum, and the piriformis, and the other 5 lateral rotators, which are very important for relieving the sciatic nerve and sacral compression. And I always will go here and check my S1 sacroiliac joint, because this is what I've been monitoring for the herniation down there. I've been checking the pressure and the tension in that area and the sensitivity in that area, which then tells me if I'm making progress or not. Because at this phase of an acute herniation in the low back, progress can be very deceptive, because the person's in so much pain that oftentimes they cannot tell